A heart attack? I mean, the name itself is pretty terrifying, right? But what's actually happening inside our bodies when this massive medical emergency strikes? In this explainer, we're going to break down the science behind what doctors call a myocardial infarction and really get to the heart of what's going on.
So, here's how we're going to tackle this. First, we'll nail down what a heart attack actually is. Then, we're going to meet the silent villain that's been building up for years. After that, we'll cover the crucial warning signs, understand why it's a desperate race against time, and then, the most important part, we'll get into the powerful steps you can take to make sure this story is never yours.
Okay, so let's get right to it. What is a heart attack? Forget the dramatic scenes you see in movies for a second. On a biological level, what is happening? It's not just a pain in your chest. It's like someone just slammed the emergency brake on your heart's entire system.
The fancy medical term is myocardial infarction. It sounds complicated, but it literally means heart muscle death. And it happens for one reason. The blood supply to a part of the heart gets completely cut off. No blood means no oxygen, and without oxygen, the heart muscle tissue starts to die. The analogy here is perfect. Think about watering your lawn. If someone comes and steps right on the garden hose, the water stops, right? And the patch of grass at the end starts to wither. Well, your artery is the hose, and a part of your heart is that patch of grass.
But here's the thing you have to understand. A heart attack almost never happens out of the blue. Nope, it's usually the final, explosive chapter in a story that's been unfolding silently inside your arteries for decades. So let's meet the villain of that story, plaque. The whole process has a name, atherosclerosis. It kicks off with some kind of damage to the super smooth inner lining of your arteries. Things like smoking or high blood pressure are common culprits. This little injury is like an open door, and the bad cholesterol, LDL, sneaks into the artery wall. Your body's immune system sees this and freaks out, sending cells to clean it up. But the cholesterol is too much, and these immune cells get so bloated with fat they turn into these things called foam cells. Over years, this whole mess of cholesterol, foam cells, and other gunk builds up into a lump, a plaque, which gets covered by a thin, fibrous cap.
Now this is where we hit a huge misconception. You'd probably think that a heart attack happens when that plaque just gets bigger and bigger until it slowly chokes off the artery, kind of like a pipe getting clogged over time. But that is not what happens in a staggering 90% of heart attacks. The real cause is way more sudden, way more dramatic.
And this quote right here just nails it. It's the perfect image for the real trigger. That thin cap covering the plaque, it can suddenly tear open or rupture. Your body immediately thinks it's a wound and does what it's supposed to do. It rushes platelets to the scene to form a blood clot and heal the injury. But here's the tragedy. That healing clot is the final blow. It's what suddenly and completely blocks the artery. So yeah, think about that for a second. A pimple popping, but inside a crucial artery leading to your heart. Okay, so the plaque pops, the clot forms, blood flow slams to a halt. What happens next? How did your body sound the alarm that it's in a full-blown crisis? Let's talk signs and symptoms. We all know the classic Hollywood heart attack, right? It's on the left here, that crushing, elephant on the chest pain shooting down the left arm, sweating. But, and this is so important to hear, what's often missed are the atypical symptoms on the right. For a lot of people, especially women, older folks, and people with diabetes, a heart attack can feel like really bad indigestion, or a sudden, overwhelming fatigue, or just a weird feeling that something is deeply wrong. These are the signs we absolutely cannot afford to ignore. And recognizing any of those symptoms is the starting pistol for an incredibly high-stakes race against time, because from the second that artery is blocked, the clock is ticking, and every single second counts.
In emergency medicine, doctors live by this one simple phrase: time is muscle. It's so direct, so powerful. What it means is that every single minute that goes by without blood flow, more of your heart muscle is dying, permanently. This isn't something you can just wait and see or sleep off.
This timeline just drives home how critical speed is. Look, in the first 30 minutes or so, the damage might still be reversible. But after that, the cells start to die for good, and the damage spreads like wildfire. A few days later, that dead tissue gets weak and mushy, creating a terrifying risk that the heart wall could actually rupture. And over the next few weeks, whatever is left just turns into scar tissue, which can't pump blood. It's just a permanent patch on your heart.
So the life-saving goal is one word: reperfusion. It's a fancy term for a simple idea. Get that blood flowing again and get it flowing now.
The absolute gold standard is a procedure called primary PCI. You might know it as an angioplasty. Doctors thread a tiny catheter up to the blockage, inflate a balloon to smash the clot and open the artery, and usually place a little mesh tube called a stent to keep it propped open. The goal is insane. From the moment you hit the hospital door to getting that balloon inflated to aim for less than 90 minutes. If a hospital can't do that, powerful clot-busting drugs are another great option.
All right, we've gone through the scary stuff, the science, the race against time. But now we get to the most empowering part of this whole conversation. Because for most of us, this is a story that does not have to be written. You have the power to be your own best defense.
Seriously, think of this list as your prevention cheat code. None of these are shocking secrets, but when you see them all together, you see their incredible power. Remember that whole plaque story? The damage, the cholesterol sneaking in, the unstable cap? Every single item on this list is a direct weapon against that process. When you control your blood pressure, lower that bad LDL cholesterol, and especially when you stop smoking, you're not just slowing plaque growth, you're making the plaque you already have more stable and way less likely to rupture. You're preventing that pimple from ever popping in the first place.
So we'll end on this thought. We've seen it all. The silent buildup, the sudden crisis, the desperate race against the clock. Knowing all this is powerful, but you know what's more powerful? Action. So the real question is for you. After hearing all this, what is the one step, big or small, that you're going to take starting today to rewrite the story for your heart?